Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. We want to thank you for coming and visiting us. We also want you to subscribe and hit the little bell icon for notifications. Jumping right to it, we want to talk about vitamins today. What exactly are vitamins?
Sure. The staff brought this to me. Frankly, I didn't think it was an incredible subject, but Em and the group saw some things. Of course it's an incredible subject.
Of course it is.
But Em and the group saw some things that they thought were kind of comical, so they wanted to do it. In our body, we have building blocks that move us from genes to proteins. It's a whole building network. Some of it is based on genomics, about moving all these genes along in order to produce proteins. But one of the building blocks involved here are vitamins. The vitamins are not the biggest part. They're one of the components that helps move the process along. And the vitamins are native to our bodies.
Right.
We have these vitamins in our bodies. Some of them we don't, so we have to supplement them through food, etc. But in general, they're necessary in order to help the movement of this information to build appropriate body structures and proteins. That's what the vitamins are for.
Okay. Who actually needs these vitamins?
Mindy on our staff asked me the question, is this the same as a vitamin supplement? So let's be clear. We have vitamins in our body.
Okay.
The vitamins that you get, that you buy in a pharmacy or a market or a health food store, those are supplements because they're supplementing what is already there.
Okay.
Okay? There are what's known as fat-soluble vitamins and water-soluble vitamins. The fat-soluble vitamins A, D, E, and K are taken up by fat tissue. They last a long time in the body. So in general, people don't need as much of them. You get them from foods and specific foods. The water-soluble vitamins don't last as long in the body because they have to be taken up in the water of the system. And as people get older, they have less water, they're not as hydrated, so these get taken away. And if you'll excuse the expression, people who take a lot of vitamins, you can see from their urine that it turns yellow. They are just evacuating all these B vitamins because there was more than what they could use. Now, who needs it? Effectively, young people and middle-aged people don't need them at all. They get most of what they need from their food. Now, I know that that's contrary to what goes on in the commercial world, but take them, don't take them, it doesn't matter.
Right.
Elderly people do need some vitamin supplements and can usually get it with a multivitamin supplement, multivitamin and mineral supplement.
Right.
And then there are people who have specific conditions that need vitamin. But most important thing is, in general, vitamins have what's known as a very broad therapeutic index, which means you can't hurt anybody with vitamins. If you took one vitamin, you took two vitamins, other than maybe making your stomach a little upset because of that, they don't hurt anything. You're just taking a bunch of vitamins. The water-soluble vitamins you just pee away. The fat-soluble vitamins get taken up in the fat tissue and generally doesn't matter.
I mean, in general, it's not necessarily harmful if you say take too much. You take vitamins to make up for whatever's lacking in your system at the moment.
Yeah, and most of it you can pick up through food. The bottom line here is take them, don't take them. In most cases, it really doesn't matter.
So what about vegetarians, you know?
Yeah.
You know, us meat eaters are the weird ones, but a lot of vegetarians seem to be lacking a lot of vitamins.
Well, I have vegetarians in my family, so I have to be careful it's not weird.
If you're watching this, he's talking about you.
Fundamentally, if you have diets that are rich in meats, then you get some of the fat-soluble vitamins, some of the B12, vitamin E, etc. that you need. On the other hand, if you have a vegetarian type of diet, then you miss some of those vitamins that are in the meat type of products. So you have to supplement with it. Usually a multivitamin will deal with it and you can pick it up. But you have to address the fact that there's things that are missing. B12 certainly, vitamin E certainly, and things that you need to give further information, give further supplement so that someone who is doing a vegetarian diet doesn't become vitamin deficient for the wrong reasons.
Exactly. Yeah. So you got to be careful with that one, because I see it's a growing trend among, especially my generation, where there are a lot of documentaries out about how meat packing and all that stuff, and how dangerous it could be eating some of these meats that contain diseases as well. So they just give up meat altogether and just go the vegetarian route. But you still have to make sure that you're getting enough vitamins and checking your diet, and whatever you're lacking in what you're eating, make sure that you're going to pick up vitamins to make up for that loss. Also, you mentioned it's mainly the older population that is in need of a lot of these multivitamins, and it's mainly because they're getting older, but also because they seem to be prone to more diseases. Is that correct?
Well, no, it's a little bit more complex than that. As you age, and you can see it in older people, not young people like you and me,
but
older people that we talk about, not young people like him. If you look at it, you take a look at their skin and you see that their skin is sagging. They aren't hydrated as well as someone who's younger and has healthier skin. There's more water in that. Yes, your skin is wonderful.
I'm good.
It's terrific.
Thank
you. You also know that they don't drink as much water as a young person does, and so as a result of that, their whole system is to a degree water deficient. That means that when they take water-soluble vitamins like vitamin C, like vitamin B, those kind of things, there's not enough water in the system to hold on to them. So as a result of that, they need more vitamins in order to try and counteract the fact that there has been a change in their physiology and how their body is acting.
Right.
Then yes, when they have certain comorbidities and problems, then they need certain vitamins. You take some of those vitamins to prevent a problem, and others of those vitamins to treat a problem.
Right. So some of these things that we've heard, you've mentioned that you take vitamins to prevent problems. There is a certain part of this population that believes that getting vitamin C while having a cold will help cure the cold. We just want to debunk that myth. Like, well, is it a myth? First, Dr. Stern, please educate us on this matter.
Look, there are some vitamins that you need because the body doesn't hold enough or doesn't make enough. Vitamin C is one of those that you don't necessarily have enough in your body. So you do need supplements, no question about it. The difference is, do you need a supplement that has 1,000 milligrams or do you need something that has 25 grams?
Okay.
There has been a lot of commercialization of this. Linus Pauling, a 2-time Nobel Prize winner, was certainly pushing for the fact that the more vitamins you take, somewhere in the range of 20, 25 grams, that somehow would prevent colds and things like that. That's never been truly substantiated. So while certainly there's a cachet because a Nobel Prize winner said it, there's not enough data that demonstrates that in fact it's true. But it is absolutely true that humans need more vitamin C because we don't have enough reserves of vitamin C. Similarly, we don't have enough reserves of vitamin D. So you have to take some vitamin C. You certainly are supposed to get vitamin D and calcium because you're outside and you're getting it from the sun. But if you're not outside all the time, or elderly people that are in skilled nursing facilities, or different from what we used to be when we were farmers and we were outside all the time.
Or if you're an analyst and you're inside all the time.
If they're computer analysts, then clearly you don't get as much.
Exactly.
Who used to be football players where they got sun, and now they're analysts and they're doing analytics. Clearly,
huge difference.
You need some supplements of D vitamins, of calcium, certainly vitamin C. Interestingly, dogs don't need supplements of vitamin C. They have it.
Wow.
They've got a reserve of vitamin C. Humans don't. So it's not the same everywhere. Right. But it is something that we have to consider with what goes on.
So taking a lot of vitamin C, I mean, I guess it couldn't hurt, right?
It can't hurt. You're just spending a lot of money on vitamin C, and probably you're just eliminating it with your water.
Right. So let's go more into the pharmaceutical side of things, where distinguishing between brand and generic vitamins. Is there really a big difference between generic and brand?
Obviously, there's a commercial argument here.
Other than cost,
we're moving into an area where we're going to get into trouble one way or the other.
Okay.
Some people would argue that they have a brand name vitamin. It's a better design. It's not so much that the vitamins are better, but the tablet stays together. If you get a bottle of vitamins and it's all crushed on the bottom, a bunch of powder, that's a poorly designed tablet. It's a poor manufacturing product, etc. You get some vitamins that are capsules and you see that they're all broken or that there's powder. Clearly that's a poorly designed product. But having said all of that, the entire issue here is that they moved from tablets to capsules and others in order to try and come up with something that was less irritating to the stomach, that would be absorbed better, etc. Absorption doesn't matter because you're going to get it, and whether it takes an hour or whether it takes 4 hours, it really doesn't matter. You need it, it's going to accumulate in the body, so it doesn't matter.
Okay.
It does matter, for example, with niacin that people take for high cholesterol.
Okay.
So there are time-release products to try and make higher doses, because I might take 500 milligrams of niacin in order to supplement, but they want me to take 3.5 grams of niacin in order to deal with lowering my cholesterol. Now, there's a liver problem if I take too much, but in order to try and allow me so I don't get so nauseous, I don't get the flushing and sweats, etc., they try and deal with the time release in order to try and deal with that. And some of that works. You still have to worry about what the liver is doing, etc., and all of that. But having said that, in general, these products are made by everybody. They make a branded product, it goes down one line. They make a generic product, it goes down another line. It's being made in general by everybody. The color may be slightly different. Certainly the bottle is different, but we're not dealing with a lot of difference in one product versus another. So you can easily save money by doing the generic. But if you have to, and you really want to deal with the brand, do it. Either way, you're not hurting anything.
Right, other than your pocket.
Other than your pocket.
So what should the general public know about vitamins that's important that nobody's talking about?
Well, first thing is in general, take them, don't take them. It really doesn't matter. If you're a bit older, then certainly you want some sort of a multivitamin supplement. If you come from a family that has a history of macular degeneration, which has to do with the eye, and you begin to go blind, this won't stop you from going blind, but you can take it as a preventative measure, so it effectively tries to push it off so that you don't get the problem. As you get older, there's a certain genetic component to it. You're not going to fight that with vitamins, but you're certainly going to do it. Vitamin C, clearly you need to deal with so that you're getting enough in your food, or you get bone deformation problems where the bones get really weird and you get problems with rickets and things like that. And as we've talked about in certain diets, whether it's vegetarian or whether it's limited in the amount of fat or the amount of sugars and carbohydrates, etc., then clearly there needs to be some supplements to make sure that you're done. But a good multivitamin in general has fat-soluble vitamins of the C's, of the B's, has A, D, E, and K, so that you've got it. If you're deficient in the K's, then frequently you have to eat more green leafy vegetables, and the greener the better. And for some drugs, they'll tell you that you have to take certain drugs, certain diets in order to try and supplement or keep it constant so that you don't run into trouble because you have one diet, you change it, and now that changes the metabolism of the drug. Bottom line, there's a very wide therapeutic index. Take a little, take a lot. Yes, it affects your pocketbook. And at the end of the day, if you like one, like another, it doesn't matter. And some people like parts of it. The first generation Hispanic population really likes a shot of B vitamins.
Really?
It's a stimulant. It makes them feel good. So they go, they bend down, they get an IM intramuscular shot of B vitamins. As you move out of the generations to their younger kids, they look at it and say, I don't want a needle. Em is shaking her head. So there are a lot of cultural, emotional, whatever. At the end of the day, they're vitamins. Take them when you need them. Certainly get some advice from a pharmacist or a physician if you need it. If you're not out in the sun or you need certain additions. But vitamins are good things. You need them. You get a good diet and you're effectively getting what you need. If you don't think so, go get a good multivitamin. And if you want to store it up, be like my wife's grandfather who had a health food store who wants you to take a dozen vitamins a day. And unfortunately, that's one of the things I have to do in order to keep his granddaughter happy and healthy, even though...
Yes, you have to do it.
I don't think much of it.
That's what happens when you get married. Well, I mean, I guess like the bottom line is just the keynotes, and make sure you keep a good healthy diet that includes meats, greens, vegetables, all that. If you don't want to eat meat, make sure you're getting the vitamins from another source to supplement some of those vitamins that you're losing from not eating meat. Listen to your doctor. Your doctor will tell you if you need more vitamins or not. Also listen to your pharmacist. Your pharmacist should have all that information readily available for you. And that's all we have for today. So just a reminder, please click the subscribe button. Click the little bell to receive notifications. Make sure you like, comment, and we will have a new video for you every Friday with more exciting healthcare topics. All right? We'll see you then. We'll see you next Friday.